What are the symptoms of COVID-19?
Well, the most common is fever, dry cough, and shortness of breath. But you can also have aches and pains, tiredness, headaches, sore throat, diarrhea, and some others that are similar to the common cold and flu. Some patients reported having loss of smell and taste. About 1 in 4 people with COVID-19 might not have any symptoms, but possibly still spread the virus.
When should I go to the hospital?
You should go to the hospital if you have any shortness of breath or difficulty breathing and you think you might need some oxygen. Otherwise, about 80% of people recover without needing special treatment. You can stay home and manage your symptoms with over-the-counter medications and follow local guidelines. If you are ill with fever and cough, clean hands frequently with soap and water or with alcohol-based hand rub. Stay at home. Do not attend work, school, or public places. If possible, stay in a separate room away from other family members. Open the window, use your own bathroom, and sneeze and cough under your elbow. About 1 in 6 people develop severe symptoms and need hospitalization. Older people and those with underlying medical problems like high blood pressure, heart disease, and diabetes are more likely to develop serious illness.
How does this thing spread? Is it airborne?
The virus is spread person to person, usually through respiratory droplets. If an infected person breathes, coughs, or sneezes, the virus can travel on droplets short distances and be inhaled by nearby people, or they can land and contaminate surfaces. If you touch the contaminated surface, then your eyes, nose, or mouth, the virus can enter your body through your mucous membranes. That's exactly why social distancing, keeping 1 meter or more away from others, is important. When running outside, don't run behind anyone and keep at least 20-meter distance. The virus can become aerosolized during certain invasive procedures like intubation and mechanical ventilation. You should wash your hands using soap and water regularly for at least 20 seconds. This kills more germs than hand sanitizer. COVID-19 is pretty contagious, with every person infecting 2 to 3 other people.
What about ordering takeout? Can it survive on my food?
So far, there has been no cases of food-to-person transmission. It is safe to order takeout and delivery as long as you wash your hands before and after receiving your food. The virus can survive on packaging.
How long will it survive on surfaces?
A study conducted and published in the New England Journal of Medicine suggests that the virus can survive on paper and tissue paper for 3 hours, cardboard for 24 hours, stainless steel for 2 to 3 days, and plastics for 3 days. Although it's important to note that the amount of virus that remains after a few days is very low and unlikely to cause infection. The virus is unlikely to survive on packages that are shipped because of the constant changes in temperatures and pressures.
What's up, Doc? Why don't we quarantine for 14 days? Huh? What's that about?
The incubation period for COVID-19 is 2 to 14 days. This is the period between getting infected and first showing symptoms. This is considerably longer than the seasonal flu and other viruses. So if you don't develop symptoms in 14 days of quarantining, it is reasonably safe to assume you don't have COVID-19. However, asymptomatic cases do exist.
Hey, so I had coronavirus before. Can I get it again?
We still don't fully understand the immune response to the novel coronavirus, but for most pathogens, the body develops memory cells that create antibodies that can recognize and attack the virus if it is encountered again. These cells protect you from reinfection by the same virus in the future. However, viruses can mutate, which means next season the virus might look a little different and surprise the body again.
You think I should wear a mask?
The CDC now recommends covering your face with a cloth when in public places where social distancing measures are difficult to maintain, like the grocery stores and pharmacies. and you should always wear a mask if you are sick or caring for someone who is sick. However, the best way to protect yourself is to maintain proper hand hygiene and social distancing measures. There is little evidence that a mask can protect you against coronavirus, but as this video shows, it does limit the spread of your respiratory secretions. Additionally, there is a huge shortage of masks, which should be kept for use by healthcare professionals. Also, wearing a mask might give false sense of reassurance and might lead to other infection control practices being ignored, like less hand washing and social distancing.
Will warm weather stop the outbreak?
It is not yet known. Some other viruses, like those that cause common cold and flu, spread more during cold weather months. But that does not mean it is impossible to get sick during the warmer months. Generally, coronaviruses survive for shorter periods at higher temperatures and higher humidity, and in cooler, drier environments. However, we don't have direct data for this virus. We'll see with time.
What can I do to boost my immunity?
In general, you should eat nutritious foods, including a lot of fruits and veggies. The more colorful the fruits and vegetables are, the better. Exercise. Manage stress through yoga, prayer, or meditation. And get good night's sleep, as a good sleep has proven to improve your immune cells. Feeling depressed, anxious during quarantine? Socialize using FaceTime. Avoid news and social media. Pick up a new hobby like
painting, cooking, dancing, or reading.
Yeah, get creative.